So both of you work together, plastic surgeon, cosmetic dentist, doing dental implants as well. And your father started this.
Right, right. Well, you know, it's a great combination. And as you mentioned, our dad started this. He was a dentist and a plastic surgeon. So essentially it took both of us to do what he did in his lifetime.
So how are you a dentist and then a plastic surgeon?
Well, our father actually started out as a dentist in the dental field, was actually working his way in his career. And then he went to do his oral surgery training in New York City at Mount Sinai Hospital. And when he was there, he was treating some of the individuals that were the offspring of the Hiroshima victims that had the cleft lip and palate deformities. And in that process, he got a liking to the plastic surgeons that he was working with and decided he wanted to be a plastic surgeon. So he went back to med school, and then, yeah, it was a lot of training.
So then, so you're the older brother.
I am.
Is that right?
I am.
And now you're in this practice. So you do plastic surgery.
Yes.
And you do the dentistry.
Right.
What is your role? I mean, you guys work together?
Well, we do. It's very fun, actually, over the years. Like Sam mentioned, we worked for 20 years with our father, and so he was, you know, the patriarch of the practice, and had a lot of patients that he would refer to me and he would refer to Sam, and then the three of us would collaborate a lot of times on some of these cases, especially on the cleft lip and palate children and things like that, which required dentistry as well as plastic surgery. So we started collaborating on a lot of different procedures, and certainly, you know, patients that come in for a facelift, if they have dentures that don't fit right, doesn't fill out their mouth properly, they need to have those dentures redone, or they need to have implant dentistry. And so we oftentimes work together on those type of procedures.
And you know, our dad named it Aesthetic Associate Center because we're predominantly focused on the aesthetics of the face or the smile, the teeth. And our center is really focusing on aesthetics. And now Todd and I predominantly do aesthetic dentistry and aesthetic plastic surgery.
Now I've had both of you on my show,
Yes.
interviewing separately. But it's an interesting dynamic here because you mentioned that there's certain people you give them that youthful look in their face, but then they have an old smile.
Right.
So then they go to you. Or opposite is true. You give somebody a youthful, beautiful smile, but they have a tired face.
Right.
So do you refer to each other?
Oh, very often.
Yeah,
I mean,
absolutely.
That's really nice when we can collaborate on the procedures that we do, because then we know the patient's getting the whole, you know, rejuvenation effect and the whole, you know, restoration effect if it's a dental
A
problem.
week doesn't go by where I may have a patient in my chair and I'll go say, hey, Sam, could you come over and take a look at this
is that right?
patient?
Oh, yeah.
You know,
And
she
vice versa, too.
needs some fillers in the cheeks, or you know, or some Botox in their forehead, and same thing with him. He'll come over and say, I have this patient that had all this work done, but she really wants to get this front tooth fixed, or whatever it is. So we work together.
Now in Buffalo, and we're here in California taping this, but apparently you guys are all over TV in Buffalo. Everybody knows you guys.
Well,
Right? Is that right? Do you get recognized?
We're definitely recognized.
we get recognized.
I mean, you're on the local news. You're all over the place.
Well, you know, we've been doing this for a long time. We've been in practice together for 25 years. Our father established a practice that was well before we joined him, and it just sort of evolved over the many years. I wouldn't say we're famous. I like to think that, you know, we're present in the community. We live there. We were born and raised there. We trained. A lot of our training was done right in Buffalo. So we're just part of the community.
Now, by the way, with you, do you refer him a lot of patients?
We do, yeah, absolutely.
I know he refers you, but
Oh, sure.
Is
Well,
that right?
you know, if I see a patient that's come in with dental disarray, that's the term I use, I'll say, look at Mrs. Smith or whoever, you know, why don't you go see my brother? You know, we can help rejuvenate your face, but I can't do that without a beautiful smile.
How do they respond to that, by the way?
Well, they understand because they're there for
Most of them are very
beautification.
excited, actually, to know that we can help them in both aspects. And he does refer I'd say we refer equally to each other. And it is exciting. And to answer your question about the public awareness of us, yes, there's a public awareness, you know, and I'll be at the mall or at a football game, and someone will say, hey, that's Dr. Shatkin, you're on TV. Yeah. And yeah, it is kind of fun to be kind of a little celebrity.
Now, do you pass each other in the halls at the office?
Well,
or
we
you're
have
pretty much
we have
on
two separate wings, but we see
Okay.
each other pretty much all day long. I mean,
You guys get along great, by the way. It's funny to watch you here in our studio.
We share a
You seem to
common-
be, you're kind of funny, he's funny, but you kind of feed off each other.
well, you know, we both have our individual personalities.
I've been
but
called a
they-
lot
they
of
work-
things, but usually funny
Who's the
is
funny
one.
one? Who's the most
Well, I don't think either one of us is funny. You know, one thing about us, both of us, I think we love what we do every day. We're very relaxed. We enjoy life and we enjoy the day. So whether we're interacting with patients or interacting with each other, it's just an easy, relaxed day.
You know, we try to have lunch together during the week as
Good.
often as we can. And that
Tell
type
me
of
this,
thing.
and we're going to wrap up here. somebody doesn't like the way they're aging. Why your brother? Tell me about it.
Well, I've seen the work he does. It's phenomenal. I've seen both family and patients alike who've had tremendous results from the work that he's done, and I tell everybody he's the best.
You believe that? That's good. What about your brother as a dentist?
Well, that's easy, Randy, because you know what? There's no one with more experience with dental implants and aesthetic dentistry, and certainly not in Western New York or almost
he is known all over the country.
all over the world.
Yeah.
And I can confidently tell the patient, you know what? You've got this problem. You really need to see my brother. And they've got a great team over there too. So that's an easy thing for me to do.
Okay, good. Well, so what's next with the Shatkins? I mean, you guys have been in this now, what, 30 years? You're from your father?
25, yeah.
25 years. Over 25 years.
And the father
Well, you know
before
what's next is his son wants to be a plastic surgeon and my son wants to be a dentist. So
Now that would be something.
The next generation is
right?
coming along.
Yeah, that would be great. And the one thing, though, I should add is this. You know, we really commemorate our mom and our dad in our office setting. We've set up a Shatkin Learning Center in memory of our father. That was a very big part of his life, teaching students, teaching residents. You know, we teach doctors in that facility. We teach the lay people about wellness and health and nutrition and dental care. So that's our father's legacy, and we hope to make that our legacy moving on to the next generation.
Okay, good. I want to thank both of you guys for coming on the show and doing this little bit.
Thank you very
All right,
much.
we'll see you. We'll see you.
It's a pleasure.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.